This video is presented by Trax WA, Training Centre in Subacute Care. In this scenario, 38-year-old Rose is recovering from a right-sided stroke she suffered a year ago. Today she's visiting clinical psychologist Jared Munro about her low mood, sleep disturbances and avoidance of social interaction.
Do you want to come through?
Sure.
So Rose, thanks for coming in today. I know it's not easy, coming along and talking to someone that you haven't met before about some things that can be pretty personal. But I hope that if we sort of put our heads together, we might be able to get to the bottom of what's bothering you at the moment. So look, I got a referral and we did some screening and with this thing we call the K10, and in that we noticed that maybe you were suffering with like a mild depression, and I wonder how that sounds to you.
I knew that I haven't been myself and I haven't been feeling right, but I thought that was just a side effect of the stroke. I wouldn't have thought I was depressed.
So even though you didn't know the cause, you sort of had this sense that sort of something was wrong?
Yeah, just like really tired, no energy, and just not doing like the stuff I would normally do, just not me.
Right, so even though you're getting lots of sleep, you don't feel rested?
No, like I feel like I'm sleeping a lot, and I go to work, I come home, I go to bed, and I'm sleeping through the night, and I wake up and I just still feel so tired in the mornings with no energy.
Yeah, and so how long has this been going on?
Probably maybe 4 or 5 months.
And is there anything else going on?
I'm probably drinking a bit more than I normally would, like drinking alcohol. I would come home from work now and pretty much have a couple of drinks every night and then go to bed.
So it sounds like you're in a really different place at the moment than you want to be.
Yeah, this is not me. Like I really don't like being this way. Since the stroke, I'm just not myself, and I don't want to be like this.
Okay. And what about your appetite? How's that?
I think I was pretty good at making healthy meals and, going out with friends for dinner and stuff. And now I'll, just pick or have some snacks and then a couple of drinks and then straight to bed.
Right, so you're pretty isolated at the moment?
And I'm not going out with my friends like I normally would, and just same routine.
Like if there was something that you wanted to do about where you are at the moment, what would you want to do?
I just want to be like I was before my stroke. I don't want to be like this anymore. I'm tired of being like this.
Right, it sounds like you're kind of stuck.
Yeah, this is not me. Like I really don't like being this way. Since the stroke, I'm just not myself, and I don't want to be like this.
I wonder if we might kind of put our heads together and talk about some of the things that we might be able to do to maybe unstick you from how you're feeling at the moment. Would that be okay?
Yeah.
Okay. So one of the things where we might start is with, taking some medication. No?
No, I'm not taking tablets.
That's so
No.
definitely no tablets?
No.
Okay. And look, I respect that. That's your decision. Instead of medication, maybe as important or more important for someone in your situation, then might be like talking to someone like a therapist or a counsellor. How does that sit with you?
Yeah, I remember actually when I was in hospital, there was a a lady psychologist there that I had a few sessions with, and I remember thinking that was pretty good.
Okay, so you had like a connection with her?
Yeah, I felt pretty comfortable with her, and it was helpful talking to her, and I'm pretty certain she was happy for me to just give her a call, you know, like later down the track if I needed some help again with how I was going.
Okay. I sort of get a sense that you might be kind of willing to kind of do something about that. Like if I asked you on a scale where 0 is I'm not ready to do anything about it, and 10 is like I'm really ready to do something about it, where would you say you are between 0 and 10?
Probably, I reckon 6 or 7.
Okay, like a 6 or a 7. Right, and why would you put yourself at like 6 or a 7 and maybe not around about a 4 or a 5?
Well, I don't want to be like this. This is not me, and you know, if that's maybe something I can do where I don't have to take tablets, then I'd probably be willing to look at that.
And so, do you think that we might be able to put like a bit of a plan together about how you might get in contact with this person?
Well, I know, like when I just got out of hospital and I'd started going back to work, I had a couple of sessions with her, so where I would go and see her after work. So that'd probably be something I could do again. I could maybe give her a call and try and organise seeing her after work some days.
Okay, and you're confident that you could do that?
Yeah, like if it means I don't have to take tablets, yeah, and if it means that I can get back to being like I was before my stroke, you know, I'm just sick of being tired and being like this.
Okay. A couple of other moves we can make as we look at exercise and diet. And look, and I understand that, you know, being as fatigued as you are, that exercise might not seem like a really sort of good place to start. In some studies it's been shown that exercise is sort of as effective as taking an antidepressant for mild depression. So what exercise does is it sort of stimulates serotonin in a similar way to antidepressant medication. Serotonin is this kind of feel-good hormone, and that can also help with not only with your mood but also with decreasing your stress and helping you sleep better.
Okay, yeah, I think I've heard of something like that. I think I've heard of serotonin. Okay. Yeah.
Sort of knowing that, is there, you know, a part of you that might be interested in maybe looking at doing some exercise?
To be honest, I'm so tired. I don't know that I'd have the energy to get started.
Yeah, I can understand that. I think getting started is often the hardest part. Like, you know, that scale I gave you before about, you know, 0 being not ready to start a exercise program and 10 being really ready, where would you say you are right now?
Probably with the exercise, about 4 or 5.
4 or 5, okay. So just sort of sitting on the fence.
Yeah.
Yeah, okay. I wonder, like, what would you being at a 6 or a 7 look like?
Well, I suppose if it means that I don't have to take tablets and, you know, I can do the things that I was doing before, like socialising, and I've got energy and I feel better, then, you know, maybe I could contact some of my friends and sort of look at that a bit more, I suppose.
And are they like, you know, friends from work or friends from your community?
Well, I've got some really close friends who are right into their exercise. So there's a couple of friends who like running and some that walking. And a community, there's like this community group on the weekend, not far from where I live. So that could possibly be an option, I suppose.
Out of those, like, which are you kind of drawn to the most?
I think probably my friend Alice. Okay. Yeah, she exercises a fair bit, and and she would probably be a good exercise buddy.
Okay. So do it on your own. Probably not going to happen, maybe 50-50. Get Alice involved. Sounds like it's going to get you over the line there.
Yeah, there's no way. And I'd probably need to, call her on the way home from work rather than actually just getting home.
Yeah.
Because then I'd probably...
That's it.
I don't think I would do it.
Right,
And definitely not in the morning. I'm too tired.
Mornings are bad. Okay. So let's make a plan. When do you think you might be able to get in touch with Alice and maybe kind of look at starting there?
I could probably just really call her straight away and organise that.
And take your stuff to work?
Yeah.
Yeah.
Yeah, it's not that hard, I suppose.
Right, okay. Even though you're feeling kind of fatigued at the moment and, that your mood's kind of down and your energy's down, there's a couple of things that you can do and you seem pretty committed to doing, like getting in touch with a counsellor, getting in touch with Alice and starting some regular exercise. So if it's okay with you, I'd like to check in on you in a week's time and see how you're going with those plans, and also just see how you're feeling, if that's okay.
Yeah, that'd be really good, Jared.
Okay, great. Thanks for coming in today.
Thanks for chatting with me.
My pleasure.
Trax WA would like to thank the staff of Solutions Health Psychology for their involvement in this project. This project received funding from the Australian Government.